Hello, and welcome to the basics of CPR. Today we're going to teach you how to administer CPR to an adult or a child over 8. If you come across someone lying on the ground, the first thing you'll need to do is assess the scene. Make sure it's safe. Are there any safety hazards? You can't help anyone if you become a victim too. If the scene is safe, check the person for a response. See if they're responsive. Tap on their shoulder. Ask, "Are you okay?"
Are you okay?
If there's no response, yell for help. Tell a bystander to call 911 or get an AED if possible. Many facilities will have an AED available. Next, check the victim to see if they're breathing. Scan their entire abdomen for no more than 10 seconds. Agonized breathing sounds like gargling or gasping. This is not normal breathing. You must start CPR. Start by checking for a pulse. Locate the carotid artery on the neck. If they have a pulse but are not breathing, you should give one rescue breath every 5 seconds, rechecking their pulse every 2 minutes. If they have no pulse, you should do 30 chest compressions and 2 breaths until help arrives or you cannot continue. Again, if they have a pulse, you don't need to do chest compressions, but you should do rescue breaths. In order to properly perform a rescue breath, you should gently tilt their forehead back and gently lift their chin to open their mouth. Next, pinch their nose and cover your mouth with their mouth, watching for the chest to rise as you breathe air into their lungs. If there's no pulse, you are going to need to start chest compressions. In order to perform a chest compression, place your hand in the center of their chest and cover it with your other hand for support. You need to push down at least 2 inches. Sometimes it's helpful to sing the tune "Stayin' Alive" to keep your tempo. Staying alive, staying alive, oh.
Whoa! Make sure you don't get carried away by the singing and dancing when you're doing your CPR. The few differences between adult CPR and infant CPR are:
You should check for their pulse in the leg or the arm instead of checking in the neck. Also, use 2 or 3 fingers only when doing the chest compressions on an infant. The purpose of CPR is to keep oxygenated blood flowing to the brain and vital organs.
CPR is a life-saving technique that allows for medical professionals to arrive and provide further help.
With these basic skills,
You could save lives. Get certified today!